I will do 1 minute.
Okay.
Hello, etc., and then I'll introduce you. Good afternoon, everyone. Good morning. I see the room filling in with a lot of old friends and new friends. So welcome to this workshop on getting to services. We're very excited about the program today. Very packed agenda, full of very interesting content. Before we start, I just want to remind you, you have the Q&A function that you can use to ask your questions or point any technical details you might be having with the connection. And now to kick it off, we have Nadim Nagmat. He's the Deputy Director at the Center for Entrepreneurship, SME Regions and Cities. Nadim, please.
Well, thanks, Anna, and welcome all. It's good to see lots of familiar faces and some new faces amongst us today. So I'm looking forward to an exciting conversation. As you all know, of course, this particular session is called Getting to Services, Transport and Accessibility. And it's the second workshop that we've held under this project on regional development along the settlement network. And that's looking really at the provision of services and connectivity across different size settlements, and whether they be cities, towns and villages. And we're doing that in collaboration with the support, of course, from EC DG Regio, and I'd like to say a tremendous thank you to them for supporting this activity. Now, this particular workshop, I mean, was going to have a particular focus really in terms of looking at issues of accessibility and how accessibility differs across places, especially outside of cities. So today, I think we're going to hear an awful lot about perhaps some of these rural issues and accessibility challenges in rural areas. And we really want to get a better handle of how much that daily reality impacts on somebody living in a rural area, and how that differs, for example, from living in a city. And we know there's a whole range of statistics that we produced over the years, and then we'll hear more from the speakers today about how those differences really play out on a day-to-day basis. And I think anybody who's ever lived in a city or been in a rural area will know, I think, firsthand just how striking those differences can be, whether they be in terms of accessing a hospital or accessing a school or accessing, for example, places of work. And I think those are the critical challenges that we want to focus on. And of course, we've done a lot of work within the OECD on these issues, and I flag a few of them. There's some recent work, for example, looking at the access and cost of education and health services, which really, I think, put a very strong quantitative aspect in terms of how those differences play out across areas. And today, of course, we want to have a zoom down in terms of understanding how different types of public or other sustainable transit modes impact in terms of accessibility to jobs, services, and educational opportunities. Now, other recent report, Transport Bridging Divides, I think also provides some really interesting insights on that issue. Now, one of the things I wanted to stress today, of course, is the very notion of accessibility and how we're interpreting it in the context of this particular work. And accessibility for us is really much more about the dimension of time as opposed to distance, which is perhaps the traditional way that we've thought about accessibility. And I think that the focus is increasingly much more about the time it takes to get to certain places. And we're going to hear, I think, an awful lot on that dimension from the speakers that we have lined up today. And I want to perhaps just say a tremendous thank you to our two keynote speakers, Rafael Pereira and Hugo Pullman, who are going to help us understand the past, the present, and the future of accessibility analysis. And we have the benefit of drawing on their long and very professional, I think, insights in these areas of work. We've also got, I think, two additional presentations from Canada, and that's from Alessandro Alasia, who's the Assistant Director of StatsCan and also the Chair of our Working Party on Territorial Indicators, and also a presentation from Jeroen Bastiaansen, who's Transport Researcher from the Environmental Planning Agency in Netherlands. So I'm looking forward to hearing all of those insights. Now, of course, complementing all of those keynotes and the country examples, we're going to hear from OECD colleagues as well, and who'll have a chance to present the work that we've been doing, bringing this all together, giving the very strong international dimension on that aspect of the work. So the workshop today is a really important part of this work stream that we're undertaking in this area. In the months ahead, we're also going to be working with the Working Party and Territorial Indicators delegates to develop what we call an accessibility manual, and that's going to provide methodological guidelines for building internationally comparable indicators of accessibility across different spatial dimensions. And this workshop today, of course, is going to be instrumental, or a really important part, in developing momentum and developing some of the evidence that we're going to need to develop that manual. So with all of that, I think that we're set to go, and I'm looking forward to an excellent few presentations and interventions from all of you listening in today. So back to you, Anna.
Many thanks, Nadim, for those opening remarks. Now I'm very pleased to welcome our first moderator. She's Brille Anderson, an economist and policy analyst at the OECD Sahel and West Africa Club. She collaborates with the International Transport Forum on topics related to accessibility. Specifically, she has a recent project on accessibility indicators in Ghana. So please, Brille, the floor is yours. And I think Rafa is with us. Now he should be available to talk. Please, Brille. Did we lose Brille? Okay.
Sorry, yes, I think we lost Brille. She has update problems, but she will be soon back soon.
Okay, then I can take over her role for now, because I'm actually very well acquainted with our first keynote speaker, Rafael Pereira. We are big fans of Rafa's work at the OECD, not only his work developing very important software for the transport community, R5R and many other packages, but also all his work in relation to transport justice. We've been following his work for a number of years, and we're extremely happy to have him here. He will discuss measuring access, how far we come and how far we have yet to go. And I will give him the floor now. Rafa, please.
Thank you so much, Anna, for the kind words, and thank you, the European Commission, the OECD, for the kind invitation. I'm very honored to be to have the opportunity to share some of my thoughts with you. I'm sharing my slides. Could you please just confirm you're seeing my slides?
Yes, we see them.
Perfect, brilliant. So I'll be talking about, well, first of all, my name is Rafael Pereira, and I work at the Institute for Applied Economic Research. We are a federal research institution linked to the Brazilian federal government, where we do research dedicated to trying to help inform and assess the impact of governmental policies in general. I'm most focused on spatial data science and urban and transportation policies. And I'll be talking today about, as Anna just said, measuring access and trying to give a high-level talk on how far we have come and how far we have yet to go. So a very brief understanding, it's just to make sure we're all on the same page. What exactly do we mean by accessibility? A very quick and simple illustration is when we look at a person in a city, and the city is full of possibilities, full of options. You have different health services, restaurants, schools, employment opportunities, and so on and so forth. But because of the spatial configuration of the transportation network and the spatial connectivity and performance of buses, the availability of subway and BRTs and so on, this person can only travel to some area of the city within a certain time budget. So this particular person can only reach in 30 minutes this area highlighted in yellow, for example. In practice, this determines what opportunities are actually available to that person. So what we mean by accessibility is how easy it is for a person to get to those activities and to reach to those activities. There are dozens of different ways of how we can measure accessibility. All of these different measures of accessibility, they try to capture either the quantity of opportunities that are accessible, the variety of opportunities, or some qualitative characteristics of those opportunities. And very often we discount those opportunities by the travel cost that it takes us to get to them. And in some more sophisticated accessibility metrics, we can also discount opportunities that are accessible for many different people. So if you're accessing a hospital, for example, that hospital will also be accessible by, let's say, 1,000 or 2,000 people. So there will be competing for healthcare resources in those circumstances. So regardless of how we measure accessibility of all the different indicators we have at hand, this is kind of the general framework that we can think of when we talk about accessibility. So the first thing I wanted to say before we dive into the metrics is, why does accessibility matter? And throughout my work and the work of many other colleagues in research and policy, we see a very prominent role for accessibility in promoting inclusive cities and inclusive societies more generally. From a sufficientarian perspective, accessibility is essential for the satisfaction of basic needs. Whether people have accessibility to basic services or essential services like healthcare or education, do they have enough access to satisfy their basic needs, or are they in accessibility poverty? From an egalitarian perspective, the concept of transport accessibility reveals the spatial dimension of inequality of opportunities. And inequality of opportunities is a fundamental moral concern from a social justice point of view, regardless of how of what theoretical standpoint you come from. Inequality of opportunities is a common concern, moral concern across the board. And even from a human development point of view, having access to healthcare, having access to services or to cultural activities provides people with the freedom necessary for them to participate in those activities and to develop other human capabilities. So from various different angles, accessibility has received a tremendous role in terms of promoting an inclusive society and a just society. So if from a theoretical or conceptual point of view, we see the relevance of accessibility, and we have been seeing some progress in terms of different governments and local governments being increasingly more, paying more attention to accessibility. We still have some barriers to go when it comes to measuring accessibility. Let's first talk about how far we have already come. So we have lots of tools. I'm only focusing here on open source tools, specifically tools for doing routing analysis to calculate travel times, travel distances, and calculating accessibility. Only with a very specific focus on multimodal routing tools that allows you to account for walking, cycling, combined with public transport and cars and so on, we have quite a number of open source tools that can be easily, they're easily available. A lot of them are accessible through very user-friendly APIs in R or Python, like R5R or R5Pi and OpenTreePlanner, for example. But even if you're just looking at walking or cycling, or more focused on proximity-based accessibility, there are many more additional tools that we can think of. All of them free and open access. So we're kind of well and good covered on that front of tools and for modeling. In terms of data, we are actually not that bad. If we only think about open data, which is available globally and for free, we have several sources of gridded population estimates. So we have several institutions and companies and universities that have engaged with combining satellite imagery data, administrative records, with machine learning models and population census data to estimate population counts and sometimes demographic characteristics of these populations at a very fine spatial resolution for the whole globe. So we have data sets that vary in terms of resolution from 1 kilometer, the data from the guys at CEDAC at NASA, the data from WorldPop, or the data from the Global Human Settlement Layer from the European Commission, and more recently, a very fine spatial resolution data, 30 meters by Meta Data for Good. So we know where people live across the globe, regardless if you're in a developed country or in a poor country. We have very good data, or fairly very good data in terms of where people live. another very important aspect when we think about modeling and measuring accessibility is terrain elevation or topography. And there are several different sources. Some of them are very country specific, but there is one global data set that covers the entire planet by NASA at a very 30-meter resolution, which is also fairly good. So we get that covered as well. And road networks. We do need information on road infrastructure or road networks to estimate accessibility. Well, that's where people will, upon the infrastructure people will use to travel. Most of the work that we have seen using accessibility use OpenStreetMap. Obviously, OpenStreetMap has a better coverage in large cities and in developed countries, but even in some low-income and middle-income countries, OpenStreetMap is getting much, much better with the prospect of combining machine learning models with satellite imagery. There is only a very good prospect that OpenStreetMap will only get better from now. So I would say we are fairly well covered in there, although we do still need to push some more efforts in improving the coverage of OpenStreetMap. We are very good in terms of the data availability for road networks for the entire planet or most of it. And a lot of countries have, or government or research groups have been publishing accessibility estimates. So I'm just not counting, academic papers, just looking at large-scale national projects that estimate accessibility for the entire country or for most large cities in the country. We have the Accessibility Observatory in the United States, was at the University of Minnesota, originally created by David Levinson and now with Andrew Owen. But we have colleagues from Finland, Australia, Canada, the UK. The ITF and the European Commission published in 2018 a fantastic report estimating accessibility for over 120 cities in the European Union. And we have the Access to Opportunities in Brazil, which is currently covers the 20 largest cities in the country. But I'm glad to announce that we are partnering with the Brazil Statistics Office, the IBGE, and we will be estimating accessibility for every single city in Brazil. We hope to publish this statistics next year. And I just wanted to highlight that as far as I'm concerned, Canada is the first country that published official accessibility estimates for the entire country. So just kudos to the team in Canada. It's a fantastic effort. We hope in Brazil we'll be able to follow your lead, and we hope other countries will do the same. So far, so good, but we still have a lot to cover. So this is how far we have come, but how far we have yet to go. What are the still remaining challenges and gaps that we still face in this topic? So a lot of the problems we see are regarding missing data. So for many countries, we have relatively good data, but for most countries in the world, especially in the global south, we have very few data, few data sets about that give us the information about the spatial distribution of jobs and facilities. And even in countries like Brazil or other countries where you do have information about the spatial distribution of jobs and facilities, sometimes we lack information on the quality of services or the working hours, what time the facilities open and what times they close, and also the capacity of services. The capacity of services in particular is critically important, as we have seen in the case of healthcare services during the COVID-19 crisis. So if we want to generate accessibility estimates that provide actionable information for health planning or governmental policies in general, we need more fine-grained and higher resolution with better quality and data for capacity of services and the working hours and so on and so forth. Another problem is about taking into account personal characteristics. So here, this is not so much a problem of that we don't have the data. In most cases, we might have data on individuals' personal characteristics, but most of the accessibility estimates that we see around, both in academic work, but also in policy, in the policy world, they don't really account for accessibility differences in terms of gender, age, physical disabilities, mental disabilities, and so on and so forth. And these characteristics, they can play a fundamental difference in terms of a person's accessibility level or travel behavior or travel experience. So if you want to generate accessibility estimates from, and to promote a more inclusive city and more just transport system, I think accounting for those characteristics is a fundamental step that we still need to take. And finally, public transport data is probably one of the largest barriers that we have. Like, we have OpenStreetMap for pretty much the entire globe, but public transport data, especially GTFS data with good quality, is still scarce. We have made a lot of progress over the past 10, 15 years. Many more cities are sharing openly their GTFS data, but we still have a long way to go. A lot of cities have GTFS, but the data is not publicly available, and sometimes the data is poor quality. So ideally, having more information, including GPS data, to update the travel times and the frequency of GTFS services would be ideal. Like, GTFS is just the planned service. Sometimes it doesn't represent the actual service that is being delivered to the population. We have conducted studies in Brazil showing that there is a mismatch between the service that is delivered with GPS data and the service that is planned with GTFS data. And there is a gap there. And this gap is not randomly distributed across space and socioeconomic groups. So some neighborhoods and low socioeconomic neighborhoods, some neighborhoods, especially neighborhoods with low socioeconomic characteristics, are more affected. Finally, informal transit is a fundamental challenge. This might not be a common problem for countries in the global north, in Europe or North America, but especially in Latin America, like in Mexico, where the informal public transport in Mexico City is responsible for over 50% of the trips, or in several cities in sub-Saharan Africa. Not having GTFS information on informal transit means that we are missing a big part of the picture. And finally, from a methodological point of view, this is not so much of a missing data, but it's kind of a missing method. I would say 90, perhaps 95% of all the initiatives looking at accessibility from a research or policy perspective, they only look at accessibility considering travel time. So how long does it take you? How many minutes does it take you to go to a healthcare service, or how many jobs you can reach within a certain amount of time? But these initiatives, they overlook the monetary costs of those trips and also environmental emissions. We have a few studies looking at how ignoring monetary costs have fundamental impacts about how you measure accessibility, especially for low-income people who have more strict budget constraints. And more importantly, we've been seeing how urban transportation has a big role to play when it comes to climate change. So measuring not only the monetary costs and the travel time to get to jobs and services, it becomes increasingly important to understand what is the environmental emissions of the accessibility that we promote, especially given that we can improve people's accessibility using various different strategies with public transport, with private transport, or just increasing proximity and land use mix. And these different strategies will have very different levels in terms of environmental impacts. And I think that we are missing that piece in the picture still, and we need to do more work on that front. So my final slide, I think there are still a few persistent challenges, and I just wanted to briefly mention a few of them. So for measuring access, I think we still need to expand the adoption of open data practices. We have made a lot of progress in this front over the past few years. We have seen many more cities sharing their data and governments sharing their data, but we still have a long way to go. Especially in Brazil, we have over, let's say, 50 to 80 cities that have GTFS data, and only 7 or 6 of them share their GTFS data openly on the web in transparency portals. I think it would be ideal to have some more international coordination in terms of data standards and data quality. I like to say that the GTFS data promoted a silent revolution when it comes to transportation planning and research, because a simple data standard like GTFS created a common ground for learning and sharing experiences and developing software and code. And to a large extent, we could reap some of these benefits of data standards for other forms of data sets as well, like we have seen for OpenStreetMap. Ideally, if we had some better or more commonly agreed data standards for land use activities or population estimates and social demographics, this would be ideal. And I think it would create even more momentum for expanding the accessibility research and projects across the globe. And finally, I just wanted to leave you with two persistent challenges that are not so much related to measuring access, but I think there are critical challenges in terms of how we can make accessibility-oriented policies come true. We have seen over the past few years more and more cities and countries engaging with the concept of accessibility. More people are gradually getting more convinced that we should shift the focus of our policies from trying to tackle congestion and reduce travel times, but instead we should be focusing on promoting accessibility. So we have been seeing this slow change in the paradigm of how accessibility should be the primary focus on promoting inclusive urban and transportation systems. But to make this access-oriented policies to come true, I think there are two very critical challenges. We don't have enough human capital in local governments in most cities. This might not be a problem for large cities like Paris, São Paulo, or New York, or Tokyo, but this is definitely a major challenge for mid-sized cities and small cities, where you have all of this open data that we talked about. We have all of this open software that we talked about, but people don't have necessarily the skills and the training to use those data and to use those skills, to incorporate accessibility into their daily practices and daily planning. And finally, I think we need to have a more open and political debate about how we define accessibility poverty. From a public policy point of view, one of the most important actions that governments need to do is to define what is accessibility poverty. What is the minimum level of access to schools? What is the minimum level of access to healthcare services and so on and so forth? And how do we, once we set the accessibility poverty line, we can more clearly target what are the people who are below the poverty line and what actions we need to take to bring those people above the accessibility poverty line. But to make those decisions and to implement those policies, we need to define a poverty line. And a poverty line is not something that you can define solely based on technical aspects or data analysis. It deeply needs a political debate, a democratic decision-making process where we discuss what kind of society we want to build, what kind of city we want to build, and what is the point of a just society that we want to achieve, so to speak, with these policies. So a lot of the technical analysis and research is fundamental to inform this political debate, but ultimately this is a political decision or based on normative values of how we see ourselves. So I think I just went a little bit over my time. Thank you so much for your attention, and I hope we can get some discussion rolling, and we'll enjoy the workshop today. Thank you.
Thank you very much, Rafa, for that introduction. Next, I'm going to pass the floor to Alessandro Lazia, who is the Assistant Director at Statistics Canada, and who's also the chair of the OECD's Working Party on Territorial Indicators. You have the floor.
Thank you so much. And it's really a pleasure to be part of this workshop and present some of the work we've done in Canada. And I think that this presentation is a perfect segue to the previous presentation of Rafael. I really enjoyed that. And very much in line with what he was saying. But let me start by acknowledging that I'm presenting the work, but this work was actually done by a team, and two of the team members, Bianca Ellison and Nick Newstead, are here at this workshop. I really should acknowledge their work. So this is an applied example of how country develop spatial accessibility measures. So let me take you through that. I'll go very fast on the first two slides because I think really Raphael covered very well the point that I wanted to make. And the point is that spatial access is an important dimension of social inclusion. Social inclusion has become a policy, one of the policy priority of the government of Canada. So there was this data gap. We didn't have measure to for proximity and social and spatial accessibility at the granular level in Canada, and this work really was meant to address this data gap and respond to this policy need. And the previous presentation covered very well the abundance of open source tool and open source data and the improvement that we had in computational capacity and also in the geolocation of official statistics and open data. And that there has been really this tool and data in the past few years. And in Canada, we're quite lucky to have a relatively abundant landscape. Also official statistics. So moving to the next slide, let me start by mentioning the journey that we had toward an increasing granular and more refined spatial access measures, because we started this work a number of years ago with the first analysis for the development of an index of remoteness, and that analysis was done at the municipal level. And soon after, we realized that, again, computational capacity and data could be used for a more refined measure. We had an opportunity to work in partnership with a department focusing on housing policy, and with their collaboration, we developed a proximity measure database that we released in 2020. And this was the first example of measure developed at the neighborhood level. And in the last year, we released the same measure for rural and small town Canada, in which we adapt the buffer for the computation of proximity and accessibility. And more recently, we focus on spatial access measure, in which we accounted also for the mode of transportation. In the next few minutes, let me focus on this last data product, which is the spatial access measure. And really, the focus here has been on a highly granular measure at the dissemination block level, which is basically a block in urban area, so neighborhood level measure, that account also for a different mode of transportation, specifically for public transit and active mode of transportation. So we look at 4 modes of transportation. In fact, we distinguish between public transit during peak hour and public transit during off-peak hours. And then we look at cycling and walking, and types of service and amenities: healthcare, primary education, post-secondary education, grocery stores, sports and recreation facility, cultural and art facility, and place of employment. And this combination resulted in 28 spatial access measures, again, at the block level for all of them. So pretty large database. Now, let me spend a few words about our definition of spatial access, because in the rest of the presentation, when I refer to having spatial access or not having access, I will refer to this definition. So for public transit during peak hour, access is represented by the degree to which a type of amenity is accessible within a 90-minute trip on the transit network during peak hours. For access by public transit during off-peak hours, is represented by the degree to which a type of amenity is accessible within a 90-minute trip on the transit network during off-peak hours, which we define between 2 p.m. and 4 p.m. And then access to cycling is the degree of accessibility within a 30-minute bike ride. And access to walking, similarly, is accessibility within a 30-minute walk. Again, of course, this time parameter could be changed, could be tweaked, but those were defined in consultation with our stakeholders and policy department and also some academic colleagues. So the source of data that we use, and again, this really is a very good segue to what Rafael was saying in the previous presentation. This work was a major effort in terms of data integration. We combined Stats Canada data holdings with open data, and really open data were important for the achievement of this analysis, this result, but also Stats Canada data. We use the business register with the location and the size of amenities. We use what we call the linkable open data environment, which is a product that we developed at Stats Canada, and it's about integration of open data from municipal businesses. We use that for the location of amenities and services. We use GTFS, General Transit Feed Specification, for public transit, which are relatively good in Canada, although there are some gaps, as was highlighted in the previous presentation. And we use OpenStreetMap for the road map. And again, we use the highest possible level of geographic granularity in Canada, which is the dissemination block, a block in an urban area. And we combine this with building footprint data to improve the accuracy of the point of origin, point of destination. In previous analysis, we used the geographic center of the dissemination block. But in this analysis, we want to be a little bit more accurate. We had building footprint, so we use that to approximate the location of individual in a dissemination block. It's particularly important for rural area where you have very large dissemination block. And then, again, how I mentioned in the previous presentation, we made extensive use of open source software and application. All the computation were done in R and Python, and distance computation and routing engines that we use are largely open source. We use R5 for public transit and in Valhalla for cycling and walking. Yeah, we did some testing, and those were the ones that worked. Some additional highlights about the method. Of course, the computation was quite taxing and intensive. The origin destination point that were computed were over 2 billion. So it's fairly demanding. We use robust calculation in the sense that we use scheduled variance. Scheduled variance was accounted for using R25, R time window features. And we did some optimization in the routing by weighting different routes that had extreme change in elevation and giving more favorable weight to routes that were dedicated, for instance, to cycling infrastructure. Now, the model that we use for our computation is a fairly straightforward model, and it's largely established in the literature. It's a gravity model that accounts for the number or the size of service available within a certain distance radius, and a possible penalty for increasing distance from origin to destination. So essentially, 2 components: the mass, the size of the service, and the distance, so mass divided by the. That this general model has been adapted in all the analysis, as well in specific analysis of spectral access measure. And in this specific analysis, again, the attractiveness of proportional to the size, the mass of the destination, and to the willingness to travel from the origin to the destination. And for willingness to travel, we use an impedance function. and the shape of and slope of which is calibrated according to mode of transportation and destination amenity, this done empirically using Stats Canada time used from the General Social Survey. Again, this is another example of how national statistical office data can be used in the computation of measure. For the results,
Alessandro, I just want to say you're at the 10-minute mark, so if you could wrap up the next couple of minutes, please.
I will. Thanks. So I will not take you through the 28 measure that we developed, but of course we can break them down at the national, subnational level. So you have an example here. We can generate estimate of access at the national level, and then when you go down at the provincial level, you start to see some variation. But when things becomes very interesting when we start to look at the local level. And this is really where this type of measure can be used for analysis of accessibility in different neighborhoods and a better understanding of where amenities and services are located in relation to the transportation network as well. This is an example of access to post-secondary education, primary education in peak transit hour in Quebec City. Again, a lot of information to go through, and I will just leave it to you to have a better look. What is next? I'll conclude with these two slides. Of course, a lot of analysis and policy modeling can follow, and a lot of that is taking place in policy department and in combination with geolocation of different demographic group. And here the analytical opportunities are really endless, vast. We can look at access by various demographic, by minority group, etc. But what is interesting is that a lot of this research and analysis is also done by independent researchers and digital journalists. I reported two examples of articles from major national newspaper, the Globe and Mail, and CBC, which is the national broadcaster, on the use of this proximity, in this case, the proximity measure database that we use for analysis of urban density. Again, I'll let you read the article. They're quite interesting. My very last slide is about the difference in policy focus and different measures that we can develop. And the point that I really is that there are different policy needs. Each agency, I think, level of government, and even countries, since we're talking about in an international context here, they may have different focus and need, and this measure can be used to identify underserved community, develop quality of life metrics in relation to, as well as support infrastructure investment and long-term for service delivery to improve efficiency and spatial location. So many different use. In Canada, the emphasis has been on a lot of these measures were developed in housing on the national housing strategy. I want to end on a very positive note. I think when it comes to spatial, the sky is really. For instance, we are now developing a measure of proximity to veterinary service, plus modern spatial access to care for rare disease. So again, as we watched in the previous presentation, a lot of methodological development are still possible, but a lot of application in other domains are also still possible, and we are still discovering that. So I'll leave you with some additional resources and the contacts, myself, Bien and Nick. If you have any question or want more information, we'll be happy to follow up. And there is an upcoming working paper on the spatial access measure that will be released soon. Thank you.
Thank you so much for showing us that impressive work. Now I'm going to pass the floor to Alison Weingarten, who's an economist and policy analyst in the OECD CFE and is one of the organizers of today's webinar. So Alison, you have the floor.
Thank you. So today I'm presenting some cross-country work that the OECD is doing, and I'm doing it with colleagues. It's sponsored by the European Commission, so it's part of the inspiration for today's workshop, in fact. And it's looking at transportation links and also access to services in settlements of OECD regions. So more specifically, we're looking at an internationally comparable definition of settlements, so cities, towns, and villages within OECD countries, and we can compare across OECD countries in terms of service provision, accessibility, so spatial relationships between different settlements, and also the role of public transportation. To do this analysis, we use mainly 3 pieces of data: population grids, service locations, and travel time data, both by car and by public transit. And we do it for European countries, and also where we can for a handful of other OECD countries. So, So I'll also talk you through some of the results that we find from our 3 different work streams. So the first work stream that we have is on access to services and provision of services within settlements. So looking at settlement size, and again, accessibility of given settlements to both smaller and larger settlements nearby. The second work stream that I won't talk as much about today is looking at population changes and especially patterns of urbanization, especially in European countries over the last decade. But then the third work stream that's also very relevant for today, which is still work in progress, is looking more closely at travel time, transport modes, and the interaction with the provision and accessibility to services. So just to give you an idea of some of the patterns that we see across countries, this is a snapshot of 6 places in the OECD. There's a very strong relationship between the number of services, so the points of interest, just counting the specific service locations of private and public sector services, health, education, banks, and the population of a given settlement. So going from villages to cities, as settlements get larger, they tend to have more services. And in our study, we look first at those basic relationships across settlements and countries. So we do regressions looking at the number of service locations for common services like schools and pharmacies. And for less common services, we look at whether there is the presence of at least one of those services, like a hospital or a university. So our first finding is that even controlling for the size of a settlement, there is a role of centrality. So what we call a regional center, which is a place that can be accessed and is the largest place within 30-minute drive. Those provide more services. Then when we look at smaller settlements that are not regional centers, we have another finding that actually places that are farther from cities, so more than a 30-minute drive from a city, tend to have more services themselves compared to villages or towns that are near larger cities. So clearly, accessibility matters for how many services a settlement is providing itself and how many it might, its residents might be getting from another place. So in the next part of our study, we overlay transportation, public transportation on settlements and look at how population around settlements does in terms of reaching the settlement itself, and whether that can also interact with the provision of services in the central place. So we look at both public and private transportation. So we're comparing car to public multimodal trips, and then we're connecting that with service provision in the settlements. To do that, we enlisted the help of the European Commission's Joint Research Center, and we're able to do this analysis for, so far, 5 OECD countries plus 2 other regions with good GTFS data feeds. And the idea is that we set a time threshold, in this case, 30 minutes. And within those 30 minutes, we have the entire public transport ride. We assume that it happens during a peak morning time and that it's essentially people from outside of a city, town, or village trying to reach the closest point within the settlement. And we allow for a little bit of walking buffer on the outside of that. So we find that in terms of the population that can access a settlement, the ratio that has public transport access to those that have car access within a given time threshold, like 30 minutes, is quite low. And in fact, as you increase the time thresholds, in some countries and regions, the ratio increases, but in others, it falls. So it just depends on how much population you're adding by car versus by public transit as you increase the time threshold. In the next stage of our analysis, we'll be looking at the patterns between service provision and accessible population living outside of the settlements themselves. So before I showed you the very strong relationship between points of interest and population of the settlement, here I'm showing, again, points of interest on the vertical axis, but on the horizontal axis, the population that's reachable within 30 minutes by car. And actually, the relationships are very ambiguous. So the more car access you have doesn't necessarily translate into more points of interest within the boundaries of the settlement. The next investigation we do is similar, but we do it instead for public transit. So how much population can reach the settlement within 30 minutes by public transit? And there, the relationship tends to be positive across the places that we look at. But again, not nearly as strong as when we look at the settlement population itself. So to conclude, our next steps of the analysis are to connect the dots to understand whether services cluster in places with good functional transport, looking at transportation performance ratios, and also building a regression framework where we can disentangle some of these relationships between service provision, settlement size, and public transit functionality.
Thank you so much, Alison, for that presentation. So now we are moving into the Q&A. And at the moment, we don't have any in the chat, but I myself have a few questions also working on this topic. So I have one actually for Rafa and one for Alessandro from Statistics Canada. And then also for Alison, don't worry, I haven't forgotten. So to start off with Alessandro, I thought there was an interesting connection to Rafa's presentation because he talked about this threshold for accessibility. And I noticed that in your presentation, you were looking at the access within 90 minutes during peak hours by public transport. And so I was wondering how you derived that threshold, because for me in our work, for example, looking at accessibility in the cities of Accra and Kumasi with our partners, we tend to use much smaller thresholds like 15, 30 minutes, 45 minutes. I mean, the modal choice is also different in those cities, but I was interested in how you arrived at that threshold. And then for Rafa, I'm also quite interested on how, and if you have ideas on how to incorporate these personal characteristics into accessibility, like gender, age, disabilities, because especially when we run these models, I'm not sure how to do that actually. So in our work in Ghana, we ended up complementing it with a qualitative survey, actually, to try to see how the travel patterns differed between men and women. But I would be interested to knowing if you have any other ideas. And also for Alison, I was quite interested in your work and how you found that settlements that were further than 30 minutes away started to have more services than those that were in between the distance between this sort of bigger city, if I understood well. And I was wondering what you thought the implications of that were for kind of the environment and whether and also rural development, and if you thought sort of, okay, are all those settlements that are around that bigger city just going to become dependent on the car, or sort of thinking about the implications of that from an environmental and a rural development perspective. So I was just, we'll pass the floor to you guys. Maybe we start with Rafa, since you spoke first, and then we can go to Alessandro and then to Alison. And please, anyone from this audience, feel free to step in whenever.
Sure. Thank you for your question. Before I answer your question, just wanted to make a quick remark. When I showed on my slide some countries that have nationwide or large-scale projects on generating accessibility estimates, I think I should also have included the Netherlands. I think they have been doing some work on this recently, and I believe my friend and colleague Jerome Vassiensen will be presenting some of their work today. So I should just add the Netherlands to that list as well. Sorry, Jerome. So regarding your question, how can we incorporate personal characteristics into accessibility? So it's very easy to do. It's much easier to do this when we have like small-scale accessibility analysis, when you're analyzing neighborhoods or maybe a region of the city. But incorporating this into like large-scale projects like the ones we conduct in Brazil or Stats Canada and the OECD is doing with Alison's work, it's a daunting task. The easiest way is just to account for perhaps that women and men, elderly people, and especially parents with children, they will have different walking speeds. They might be less able to cycle, for example, depending on their characteristics. So accounting for those speed differences is in and of itself would be the easiest and simplest way to do this. But accounting for more subtle differences like gender, involves a lot more work because it involves not only changing the people's speed, but also the route they take. So perhaps some people, especially women and certain minorities, will avoid certain streets or paths in the city, especially in certain times of the day, because they might be afraid of sexual harassment or urban violence. And it is possible to incorporate this bottleneck, so to speak, or these barriers into your OpenStreetMap data before doing the routing analysis. The challenge here is how you determine which routes or which streets would be considered barriers by these different social demographic groups. But again, that's where your qualitative work comes in, and that's where you have the richness of doing focus groups, interviews. And now we have been seeing a lot of work using machine learning models with training data sets where you have Google Street View imagery, and people decide and choose what streets are more pleasant or more safe or they're afraid of. So you can also use this kind of tools to inform your decision in terms of what streets you will be removing from your street network when you're doing a routing analysis for this specific demographics.
Thank you. We also just had one question from the audience for you, Rafa, that maybe you could just take a quick few seconds to respond to on data sources for biking and walking, and looking at sidewalk completeness, quality, and other infrastructure such as benches, whether you even have like a paved road or not. And if you have any thoughts on that. We had one question from the audience by Andrea Tentner. You're on mute, Rafa. Hey, Rafa, you're on mute.
Yeah, that's a good question. Perhaps I should have added to my slides on what we have yet to go. Because with OpenStreetMap, we have the data on the existence of a certain transportation network link, like there is a sidewalk, but we don't know the quality of the sidewalk. And while the quality of the sidewalk might not be a major barrier for most people, some groups, especially family with children and elderly people with physical disabilities or mobility impairments, this is a major barrier. So I would say that for this large-scale accessibility models, the quality of sidewalks and this qualitative information might not be so critical, but that's a direction we should be heading ourselves to, because if we want to make our models more realistic and more inclusive, incorporating these characteristics should be a major step. And I think OpenStreetMap has a lot to improve in that sense as well.
Thank you, Rafa. Now we pass the floor to Alessandro, and also Alessandro, you had one additional question in the Q&A, which was, I guess, more of a philosophical one by Eva Hogston, who said something about how the sky's the limit, but certainly doesn't come without cost. So how to basically prioritize what we look at in terms of accessibility.
Thanks. I'll go in order and address the first question, which is a very good question, because when you move from the conceptual framework, the theory, to the application, you will have to make a number of decisions about parameterization, choice of threshold. So we had to do all of these in our work, in all the work that we have done. And for the specific spatial accessibility measure, the 90 minutes to 30 minutes were all decided in consultation with the stakeholders. So the point is that this type of decision needs to be done in consultation with a number of stakeholders. In our case, it was the policy department that was going to use this product, which is Infrastructure Canada, but also a number of academics. And I actually should acknowledge the collaboration we had with Mobilizing Justice at the University of Toronto, a number of academics there that provided input. So when you have to make all these decisions, again, it's very important to do that in consultation with subject matter and final users. And then, yeah, there is always an element of arbitrarity, but for some of these measures, again, we can rely also on some of the statistics that we have here, like some of the surveys on travel time use, which that's what we did, as well as some indication coming up from the census. For instance, we could see from census that when you look at commuting beyond if I remember correctly, about 200 kilometer radius, there is basically no commuting because nobody wants to commute daily more than 2 hours. So that 90-minute threshold is kind of a benchmark. But again, it might be very dependent on the context, on the policy need of various stakeholders. And to address the second question about cost and setting priority, for us, it's relatively easy in the sense that we are the implementation group and priorities are really set by policy department. So I really think priority setting should be driven by the policy need of the country or the organization, that agency that address this type of question. Because you know, in my shop, in my Stats Canada, we have always brilliant idea, but yeah, the question is prioritizing and the cost to implement this idea, which of course is always a consideration. So I would say prioritization comes from policy need that a country might have, a specific level of government.
Thank you. Thank you so much. And now I pass the floor to Alison, and maybe also Alison, you could comment on one question we have from the chat by Hamza Yassin, which is what to do when GTFS data is not available, so that we can have some multimodal accessibility analysis. I don't know if you've incorporated, or if you have that experience in your own work. So if you could just take a couple minutes, and then we'll have to pass on to the next session panel.
Sure, thank you. So I don't have a good answer to the question of when GTFS data is not available. In fact, that informed very much our selection of certain regions of the OECD and certain countries where we were familiar with the GTFS data and that it was a good quality. And in fact, even when GTFS data is available, my understanding is that it's difficult to verify, as Rafa said, how it matches up with the performance of the actual transit systems. Relay, regarding your question from earlier, I think it's a very important result that some settlements that are close to cities are actually hosting fewer services than settlements that might be a bit more remote and on their own. And I think that that's very informative for policymakers when they're thinking about where to locate services, and also thinking about the role of urbanization, that in fact, some of these smaller settlements that have access to a larger city might be getting these services, these higher order services from the large cities for a variety of reasons. One is that people may be going to the cities for their work, and so that's actually convenient for them in other ways. And another is just a question of variety and quality. And so it's not necessarily a problem to have more suburbanization where they don't provide as many services, but there is a very big question about how those smaller places may connect to larger places that provide important services, and then how people are actually using transit and actually gaining access to services they need.
Thank you. That was great. And thank you all for participating. Now I will pass the floor to the next moderator, which is Alexander, and who's head of CFE's Economic Analysis Unit and a key contributor to the CFE's work on transport measures and policies. The floor is yours. Thank you.
Thank you very much. This has been quite exciting so far. And given that we're a little bit over time, I think we want to keep the pace going. So without further ado, we start the second part of our workshop today on transport performance and accessibility to services within the cross settlements. We will start out with a keynote by Hugo Pöllmann, who will speak on measuring accessibility now and in the future. Hugo is the leader of the GIS team within European Commission's DG for Regional and Urban Policy. He has probably 30 plus years, I think by now, with the European Commission. And over that time, his work, especially on his accessibility indicators, has been instrumental in moving the discussion away from the demand for more roads to discussion on how to best connect people with opportunities. Exactly this kind of notion of accessibility that Raphael highlighted. And we also had a bit of a discussion in the chat that some policymakers have been embracing this concept by now. But when I started out 10, 12 years ago, we were still counting road kilometers and the number of cars on the road, rather than actually thinking about what kind of access does transport provide to people. Hugo will set the scene for the second part of the agenda, highlighting the European policy context, the requirements for accessibility indicators, with a view on current applications and challenges and opportunities for the future, for future development. Hugo, about 20 minutes. The floor is yours.
Thanks a lot for the introduction and providing a bit of insight on my background. So indeed, this talk, I just want to take the opportunity to share some thoughts on the production of accessibility indicators within the context of EU cohesion policy. I probably don't tell anything new saying that EU cohesion policy covers a very wide range of investment areas, but many of those are related to challenges where the location dimension really plays an important role, such as business competitiveness, sustainable development, or improvements to the quality of life of citizens. And several specific topics where cohesion policy intervenes are really closely linked to geospatial information and analysis. For instance, substantial amounts of the cohesion policy budget are allocated to education and healthcare infrastructure, or to road and rail infrastructure, and consequently, indicators informing about accessibility and about the performance of mobility modes can and should provide context for investment and programming data. And this policy context means that the production of meaningful accessibility indicators in our work should meet some requirements. I think the first and foremost requirement is that the indicators should be policy relevant. The topics of relevance to the policy should really be reflected in the choice of the indicators and the topic of the indicators. They should be clearly related to areas where the policy intervenes, or at least inform about territorial characteristics that are providing guidance on policy priorities or implementation of the programs that are co-financed by cohesion policy. But cohesion policy is implemented by means of shared management, which means that the member states actually carry out the programs and they contribute their national and regional expertise, while the European Commission services are there to complement this local, regional, national information by highlighting the EU-wide context that might be missing in some pieces of information that are sourced from national or regional sources. And so this is where a cross-national EU-wide development of indicators can be complementary to what is happening in the member states. An additional requirement is definitely that the indicators should be quite easy to interpret. You can find really a lot of a wide variety of sophisticated accessibility indicators that have certainly their academic merit. But producing indicators, and in particular in a policy DG as ours, is not a purely academic exercise. The indicators should really be understandable by a relatively broad audience, including non-specialists, and let's be honest, a lot of policymakers cannot be expected to be specialists in particular technical domains. Scalability of the indicators, geographical scalability of the indicators, I think is also an important asset. It's perhaps not essential, but the potential to inform about various territorial levels is extremely interesting. It ensures that we can guarantee a more efficient data management and an analysis workflow that is can be applied at larger scale, at smaller scale, and so on. And it also facilitates the communication if we are able to use similar concepts at varying territorial levels. I will illustrate this a bit further in this talk. Indicators should be referring to harmonized territorial concepts as much as possible. This is essential to ensure comparability of results. And here, this is clearly an area where we are harvesting the fruit of the joint OECD-EC resources investment in creating and promoting classifications like the degree of urbanization and definition of cities. And so as these classifications have also been translated and adopted at a global scale, it even enhances much more their interest and their importance to provide and to calculate harmonized data. As far as possible, indicators that are designed for a policy use should also rely upon open, comparable, and authoritative data, although this is definitely still a bottleneck in certain domains. And in our EU-specific case, ideally, the data and the subsequent analysis should be covering the entire EU territory, or at least all units of a particular territorial type. For instance, all cities, all towns, or so. If this is not possible, this will not stop us from developing anything, but methodological developments will still be useful and relevant to showcase the opportunities created by geospatial analysis and to trigger incentives to improve data availability. Sometimes we notice that data providers who lack motivation to contribute to harmonized collections can be better motivated if they notice that their data are actually used in European context. Sometimes they are not even aware they produce, some institutions produce data for another purpose. They are not necessarily aware that there might be an interesting analytical use case at European level out there, and well, resulting in a lack of motivation to produce these data. It may sound trivial, but in reality, this kind of demonstration effect can be a real incentive for some data providers. And finally, the indicator production methods should be implementable by means of the available technical resources in terms of hardware, in terms of software. And here in our team, we have been struggling a bit with these kind of obstacles because, well, we are a multi-purpose team, and but fortunately we have been able to rely upon specialized resources by colleagues from the JRC as well, in order to try to improve the available resources in terms of computational power and adequate algorithms to produce indicators. So we had all these principles and these requirements in mind when we implemented the joint DG Regio International Transport Forum indicator framework defining accessibility, proximity, and transport performance. In that context, accessibility has been defined as simply the number of opportunities one can reach within a predefined maximum travel time. No gravity model behind it, just a maximum travel time, and any opportunity you can reach within this time is defined as being accessible. This notion is confronted to the notion of proximity that measures the number of opportunities you can find within a predefined radius. And then both of these concepts, they are compared to produce transport performance, that is accessibility divided by proximity. We noticed that the interpretation, although simple, sometimes led to some misunderstandings, because in some circumstances, this ratio between accessibility and proximity can lead to values higher than 1, or expressed multiplied by 100, higher than 100. So we kind of reformulated the definition of performance by just constraining accessibility and performance to destinations within the proximity radius. And this even more facilitates the interpretation of the performance, because then it just becomes a percentage of, accessibility expressed as a percentage of proximity. We implemented this framework at various territorial levels. At regional level, we looked at the performance of travel by road and travel by passenger rail, whereby the rail analysis can potentially be extended to cover all public transport as well, provided that data are available. And that has been mentioned by various speakers already. This is still quite a bottleneck. In cities and in their close surroundings, we did a similar exercise, but at a much more local scale. And there we assessed performance of public transport, including short walks, starting from any populated place measured at a 100-meter grid cell size to any other populated place in the city or their immediate surroundings. And we tested this same methodology for cycling trips as well, but actually we found the results not quite convincing due to the uncertainties of the cycling opportunities information that is embedded in the street network data. So we kind of put this aside, and well, due to resources constraints, we didn't really come back in recent times on that particular topic. You may have noticed that when we apply the performance indicator framework, we mainly look at residential population as the target opportunity and not so much as at the location of particular services. This choice was mainly inspired by some uncertainties about the quality, the completeness, and the representativeness of the data on the location of services. But the framework in itself can easily be applied to any other opportunities than residential population. In addition to this, we also looked into some quite simple proximity and accessibility indicators for specific purposes, like assessing people's proximity to rail stations. This was a kind of a spin-off of the analysis of passenger rail performance, to primary schools and to healthcare facilities. And more specifically, examining some aspects of quality of life in cities, we also established a methodology to assess people's access to green urban areas, a method that is compliant with the SDG indicator definition. We have experimented by extending this analysis also to access to all open and public spaces, even those that are not only green areas. This is still something of a challenge as well. So a lot of these experiences have been described in interactive maps, shown on interactive maps, described in working papers and in technical papers, for which you find the URLs in the chat. There's one that is so recent that I forgot to mention it in this list of URLs. There's a small, nice technical paper by one of my colleagues on some indicators by individual town. So we looked into the 8,000 towns of the EU and tried to apply some of the accessibility indicators also not only by city or not only by region, but also by individual town. I will put, when my talk is finished, this URL on the chat as well. So what does this bring us in terms of challenges and opportunities for future work? Well, an opportunity for the near future is that while almost all the analyses require good spatial data on the distribution of population, the European Statistical System is about to provide Census 2021 population grid at 1 square kilometer that will not only cover total population, but also a basic breakdown by age class and by gender. And for a substantial number of countries as well, figures on residential employment, on employed people, not measured at the workplace, but measured at their place of residence, which is quite an interesting breakthrough in comparison to what we used to have in the past. And there's the additional perspective of a future regular grid production. But 1 square kilometer, in particular, when you want to analyze local phenomena, it's not really precise enough. When you want to look at diversity within a city, there's the potential of point-based, address-based statistical systems that can refer to population data that can be aggregated to very small areas, but the dissemination of such data is often limited due to rules of disclosure control. And this means that downscaling methods will still be needed in the future to produce high-resolution estimates of population figures. And the downscaling process in itself requires adequate ancillary data, for instance, on land use, on the location of buildings. And we see a real interesting development on the availability of building footprints and characteristics, both from in situ data and from remote sensing data. Progress is also happening towards the provision of authoritative location data on public services and amenities. This is still ongoing work. There's a lot of work to be done on the identification of relevant data providers that are a bit scattered throughout the administrations of member states and so on, and to streamline the data integration workflows and ensuring more harmonized definitions. We are working together with Eurostat in order to try to progress in this domain. It has been mentioned by several speakers, the domain of public transport presents this additional challenge of open data, machine-readable data, standardized data, routable data. But so we are not yet there at European level to have an exhaustive wall-to-wall coverage, but there's progress still. and routing software. It has been mentioned as well. It's a matter of finding and applying the appropriate algorithms for in different purposes. And there we are liaising with different teams from the JRC and have had recent discussions as well on trying to identify what are the most promising algorithms in our context. And last but by no means least, workshops as this one and related initiatives to collect and integrate experiences on indicator development are really most welcome. It's by sharing experiences, by discussing these bottlenecks and opportunities to overcome those bottlenecks that progress can be made. So there are many challenges ahead related to the domains I mentioned. But the good news is that we see really progress in all of these areas, although it's not always happening at the same speed everywhere. But okay, that some challenges remain. Thanks, and I will put another link in the chat, and then happy to answer questions later, or drop me a line afterwards if any question would still remain. Thanks.
Thank you, Hugo. That was very comprehensive, a tour de force through a variety of challenges with a very positive outlook at the end. Very much appreciated. We end on a positive note. Taking also a segue from your last point, please do give some thought to the questions you want to ask. Feel free to already put them in the Q&A. If there's something burning, we will then address them after our next two speakers. We move on to the examples that we have and taking accessibility into practice. We start with Jeroen Bastiaansen, who is a transport researcher for PBL Netherlands, the Dutch Environmental Planning Agency. His work focuses on how transport connects people with jobs and amenities, and more broadly, how it affects their well-being. He will ask the question whether access is truly for all in the Netherlands, and we'll do so in about 10 minutes. After Jerome, we will have a presentation following seamlessly by our colleague Claire Hoffman, who works as a statistician in the OECD's Center for Entrepreneurship, SMEs, Regions and Cities. Claire develops and collates indicators that help us better understand cities and regions across the OECD. And today she will focus on accessibility to basic and public services for residents in different types of regions. Jeroen, around 10 minutes.
Right, thank you very much for this invitation. I think my microphone is working, right? Perfect, thank you. Let me start sharing my presentation. Yeah, in presentation mode. Right. So we published a report last year in October 2022 on called Access for All, in which we made an analysis of the accessibility to amenities and jobs in the Netherlands. The context of this study was that, well, obviously one of the main objectives, as Raphael already mentioned, of our transport policies is to facilitate people with access to jobs, to amenities, to social contacts. And importantly, from the transport poverty, transport-related social exclusion literature, we know that lack of mobility, or basically lack of accessibility, inaccessibility, can reduce people's participation in society, and in a more extreme case can lead to what we call transport poverty or transport-related social exclusion. So where people remain unemployed because they cannot reach or access job opportunities, or where they miss healthcare appointments, for example, because they cannot reach the hospital or the GP. A fairly well-established literature. Now, in practice, however, in our transport policies, we mainly focus on reducing congestion, on facilitating traffic flows, and on, well, focusing on efficient, economically efficient public transport.
Jeroen, your slides are frozen. If you could just stop sharing and reshare, that might solve the problem.
Right. Yeah. Let's see.
I think you're showing. Yeah, you're showing the presenter screen and not the viewer screen.
All right. Presenter screen.
Yeah, we see your PowerPoint and not this. I mean, we see the slides from.
I would think that if I Let's
I think
see.
it's on Zoom. You can just do what you were doing on PowerPoint, but on Zoom, when you click on share screen, you can choose a different pane or different like monitor or screen.
All right. We never work with Zoom. I'm very sorry. Let's see if it's. So this is not working, is it?
Not yet.
Would you guys be able to share it? Because I'm not sure if I can sort it within those 10 minutes that I have.
We'll share it on our
Yes.
side. Alison, could you share it?
I'll just stop sharing. Yeah.
Sure.
Sorry for that, and thank you, Alison.
I can share them in if you want, Alison.
As you like, Carlos. Yeah.
So should I go?
Go ahead, Carlos.
Okay,
Yeah.
okay. There we go. Can you see
Right.
my screen?
Yeah, so we can go to the next slide, please. Thank you. So as I said, in our transport policies, again, we mainly focus on reducing congestion, facilitating traffic flows, and so on and so forth. And that was the main reason why we started developing Dutch national accessibility metrics using only open data in the same way as Rafael and the previous speakers just presented, with which we provide insight into neighborhood level access to jobs and amenities. Can I have the next slide? Yeah. Oh, just one back. Yeah. Yeah. The accessibility indicators were calculated in 3 steps. So for the destinations, we have job data sets at the national level on the 6-digit postcode level. So that's street level, basically, where you can calculate your travel times too. And for amenities, we compiles basically a big data set of addresses of hospitals, GPs, of primary, secondary, further education, supermarkets, and parks. We calculate our accessibility indicators from neighborhood level origins. We have around 14,000 neighborhoods in the Netherlands, a statistical data set with around 700 households in each. The reason for that is that people can relate themselves to those neighborhoods. We know those type of neighborhoods are well known. And we have administrative micro data sets from Statistics Netherlands of the population living in those neighborhoods. So the total number of the population, there's all their social economic characteristics, household income level, car ownership, their age, the household composition. So that's what we use. So we calculate from each origin to a destination and can also calculate how many people have a certain level of accessibility and who those people are. For the travel time analysis, as discussed already before, we use OpenStreetMap. We combine that with open access travel time data. For public transport, we use the national GTFS data sets. We have that for the nationwide. The bicycle, we can calculate it with OpenStreetMap, but the advantage of bike app data and for the car traffic speed data is that you know what those are measurements of the actual traffic travel speeds at certain times. For walking and combinations, and we calculated that also for time windows during peak and off-peak hours on a regular Tuesday in October, and for the weekend where we chose a Sunday to show what the differences in accessibility were. And what we actually find is that there's, as you may expect, obviously, is that there's very substantial differences in accessibility, also in a country as the Netherlands, where you see that people with access to a car have by far the highest accessibility levels to amenities and jobs, even during peak hours. So every half hour we hear on the radio how poor congestion is and how sad it is for all those car drivers. But even during peak hours, around 4 to 5 times as many jobs or amenities you can reach by car. And in off-peak hours, obviously, service levels for public transport go down and accessibility or travel times reduce for the car. So those differences in accessibility increase. And therefore, we see that people who have access or who have to rely on public transport have considerably less accessibility, especially also, obviously, when they live in rural areas, but also in urban fringes, suburban areas. So it's not just a urban versus rural divide, but we see the same things basically happening everywhere outside the city centers, that if you're dependent on public transport or cycling or walking, it's considerably less than accessibility provided by car. And that's also where our low-income groups, for instance, live. So the more socially and economically disadvantaged groups, typically social housing, low-income housing in the Netherlands, is concentrated in the urban fringes of mainly the larger urban areas. And the bicycle obviously plays a very important role in Dutch daily life. Around 26% of our commutes is done by bicycle. And to shops, local amenities, for instance, a lot of people use the bicycle as well. But we see a similar pattern, not just in rural areas, also in the suburbs, urban fringes, bicycle accessibility is typically limited, especially to those more regional amenities. And I have two examples in the next two slides of that. What we calculated was, as I said, accessibility, for instance, to hospitals is shown here, including clinics. I'm just showing here accessibility by mode of transport. So by car, public transport, and bicycle. And what you see here is the darker the area, the more hospitals you can reach. Within gray areas, you cannot reach a single hospital within 30 minutes travel time, and with a darker shade of orange, in this case, you can reach one or more hospitals. Now, by car, on the left-hand side, we see that basically from each neighborhood in the Netherlands, apart from the far north and the southwest of the country, you can almost always reach a hospital within 30 minutes, and very often multiple hospitals. So you have actually lots of opportunities you can reach within a travel time by car. By public transport and by bicycle, we see that accessibility is very much concentrated in the urban areas and between the urban areas along the main corridors. By bicycles, the interesting bit is that is often these accessibility levels are a bit higher, or at least spread out a bit more. And that's simply because our bicycle infrastructure, especially in urban areas, is very extensive. So it's very easy to travel a fairly long distance to reach hospitals in this case. Now, if you match that to the population data, you find, just stick to my previous slide, is that around 30% of the elderly in the Netherlands, of the low-income elderly in this case, cannot reach a single hospital or a clinic within 30 minutes. 12% also not within 45 minutes. And a similar percentages, a similar share of the low-income elderly can only reach a single hospital. And so the type of services provided there very much defines whether that accessibility level is sufficient or not. I have a similar kind of example on the next slide, which shows accessibility to secondary schools. This is specifically to middle and higher educated level that gives access to either polytechnics or universities by mode of transport. Now, obviously, this relates to young people in the age of 12 to 18 years old. Some people won't use or those young people won't use a car, but just as an example here, I'm showing the accessibility level for the different modes. By car, you can reach almost anywhere in the Netherlands within 30 minutes, one of these secondary schools, typically multiple. By public transport, bicycle, again, you see this very stark difference with car accessibility. And again, if you match that with population data, so the people that live in those neighborhoods, we see around 70% of young people that cannot reach a single secondary school for middle or higher education. For example, in this case, within 30 minutes cycling. And 10% also not for lower education secondary schools. But that's simply because there are more of those schools that gives you access to practitioner level further education after this. So similar kind of percentages of the young people can reach only a single school, so which also relates to a freedom of choice in that regard. And then to my final slide. So some main conclusions we drew from the study is that these accessibility patterns, to a large extent, reflect historical choices regarding spatial planning, design of the transport system, places where we develop jobs, amenities, but also housing. But obviously you can change them if you really wanted to, because at least partially they result from political choices. There's a huge shift, as anywhere, or at least in all Western countries, we see a huge shift in recent decades of jobs, amenities to car-based locations, to highway locations that are often very difficult to reach by public transport, but even by bicycles, very difficult to get there. Even in the Netherlands, often that type of infrastructure lacks at those places. And public transport at the same time is mainly concentrated or increasingly concentrated in urban corridors. So those developments and political choices form to a large extent the accessibility levels that we've just seen. Now, the accessibility analysis provide important insight into the consequences of those choices for different geographical areas, population groups, as I've just shown. And it also helps to, well, form a basis basically for a debate about possible standards. And that's where we are now in the Netherlands. We've been discussing this concept of accessibility is widely embraced, but the discussion now is, what do we find acceptable as a society? And do we find it acceptable that there are such large disparities between different areas, but also mainly between the different modes, by car and for those people that are reliant on accessibility provided by public transport, cycling, walking, and the implications that would have for the locations of new jobs, amenities, and housing.
Thank you very much, Jeroen.
Yeah,
we already have some action in the Q&A. Please feel free to put your questions in there as well. And
thank you
now
very much.
we go and have Claire present the OECD.
Thank you, Alexander. Can you hear me well?
Very well, thanks.
Okay, so I'll share my slides. Can you see?
Perfect.
Yes, okay, thank you. So I will present a project on geographic inequalities in access to essential services. And I will start with a bit of context. So this is a joint EC-OECD project. In CFE, our team in CFE has been working with another directorate of the OECD, ELS, for employment, labor and social affairs. And our objective was to measure the level of accessibility to 3 types of services. So first, childcare services, so early childhood education and care, then primary schools, and also public employment services, as these are 3 essential services for the labor market. Our analysis is at the TL3 level, so at OECD small regions level, and we want our indicators to be internationally comparable. So in terms of data sources and tools, we have been using 3 types of data sources. First, the location data for services. So in the best case scenario, we were able to collect geographic coordinates. When they were not available, we collected addresses and then geocoded them. These were obtained through bilateral correspondence with national authorities, but for some countries, this data was also publicly available. Then we use for the routing API the Mapbox isochrone API, and then to link it with the distribution of the population within regions, we use the GHS population grid for 2020. In terms of tool, we did all the computing using Python, with the main packages being geocoder, requests, geopandas, and rasterstats. So just to give a bit more detail on the Mapbox isochrone API, this tool allows to download the area that can be reached within a certain time from a given point. So for instance, we provide coordinates of a primary school, and then we can get the area that we can reach up to 60 minutes. So this is the limit of the API. And it includes 3 modes of transport, walking, cycling, and driving. We obtained the access through this API with the Development Data Partnership. So we were able to compute 2 types of accessibility indicators. First, we computed the share of population having access to at least 1 facility, and we focused on walking and driving. And we used 2 different time thresholds, so 15 and 30 minutes, and this reflects the frequency to which people need to access different services. So for instance, for primary schools or childcare facilities, we would focus on the 15-minute travel time, whereas for public employment service, we would use 30 minutes because people need to access, job seekers need to access those services only occasionally. Then on the other side, we also computed another type of indicators, which is the travel time to the nearest facility. Again, we used both walking and driving modes. And this is measured with 5-minute intervals. So we don't have the precise travel time in minutes, but we have a window of 5 minutes. And this was computed for the bottom 20%, the median, and the top 20% of the population. So in both cases, we are only focusing on the people having access to at least one facility. So we do not take into account whether people access multiple facilities. And on the first type of indicators, the share of population, we need to select a time threshold that we need to determine before. And then for the other type of indicators, the travel time indicators, we don't need to select a time threshold, but then this indicators is much more intense in terms of API requests and also computing capacity. And I will go back to this in a few slides. So just to give a bit an overview of the methodology for the first type of indicator, so the share of population. We use the Mapbox API to download the isochrones from each service point. So on the map, you can see the isochrones, the driving isochrones in blue, and the walking isochrones in purple for both time thresholds. So this is for public employment services in Estonia. Then we dissolve all isochrones to avoid double counting some areas and some population. And we cross this layer with the population grid to compute within each region the share of population that is within the isochrone and the share of population that is outside of this isochrone. For the medium travel time indicators, the methodology is relatively similar for the first step. So we download all the isochrones, but this time instead of downloading only two isochrones for two time thresholds, we downloaded 12 time thresholds. And then we dissolve again and compute the population within each 5 minutes interval. And then we extract for each service, we extract the travel times for the bottom 20%, the median, and the top 20% of the population. Now I'm going back to the API request and the computation intensity for each type of indicators. So when we send an API request to Mapbox, we need to provide a pair of coordinates. So for instance, for one primary school, a transport mode, and up to 4 time thresholds within the same request. So that would mean that if we have a country with 1,000 primary schools, to compute the first type of indicator, so the share of population that has access to at least one primary school, we would need 1,000 API requests per mode. And on the other hand, if you want to have the median travel time to the nearest facility, and if we go for the 5-minute interval option as we did, we would need already 3 times more API requests. But then if we want to have an indicator that is even more precise with a 1-minute intervals, we would need 15,000 API requests. So, and the computation intensity increases as well. So to give you an overview of the results. So here we are showing results for primary school. So the share of population that has access to a primary school within first a 15-minute walk and then a 30-minute walk. So we see that the access is very good in large cities, in capital regions, with more than 80 or 90% of the population that can reach primary school within 15 minutes. And then in areas that are a bit more remote, the access is much lower, same as for the 30-minute walk. But then this indicators does not allow to tell something in between those time thresholds. Once the time threshold is fixed, then we don't know what happens for the rest of the population. And on the other hand, this is the second type of indicator, so the travel time to the nearest facilities. And so here, the walking time to the nearest school for someone in the bottom 20% of the population, and on the right side for the median person. So the maps are quite similar in the sense that, again, you see that around big cities, the travel time is relatively low, so below 10 minutes or below 20 minutes, even for the bottom 20% of the population. But here you can tell something about how is it for the people who have bad access. You can assess how far they are actually from the nearest primary school. And I will finish with the challenges and limitations. So first on the data sources. So the first limitation, as it was already mentioned today, is the limited availability. in services data. We only have a few countries that publish location data. And then when this data is available, we still have very limited data on the capacity, on the quality and affordability of services. In some cases, the definitions can also be quite challenging because they differ across countries. That is the case for school levels, for instance, even if for primary schools it's relatively consistent across countries, there are still a few cases where it's not that clear. And also it's not possible yet to track changes over time. Usually when data is available, it is available for the latest year, but we are not able to go back in time. And then regarding the routing API, the big limitation of Mapbox is that it doesn't include public transport, which could be very relevant, especially for regions, for metropolitan regions, for regions around cities. And traffic is also not taken into account, which leads to probably underestimation of travel times in areas close to cities. And then the number of API requests limits the precision of travel time indicators. We went for the 5 minutes interval, but perhaps it would be also interesting to, in some cases, go a bit deeper in terms of detail. And finally, the limitation in the analysis. So there is a question around the comparability of Tier 3 regions for assessing accessibility to services. In the analysis, we use the classification by access to cities of Tier 3 regions, but this classification do not take into account the difference in settlement patterns within regions. So for instance, a remote region, we still don't know whether within this remote region, people live mainly in small towns or in villages or in mostly uninhabited areas. And it also raises the question of the appropriate transport mode. In cities, people might want to access the primary school of their kids walking. But then if you live in a very remote place, in a very low density area, it's more likely to access schools using a car. So in that sense, the degree of urbanization would allow to take into account within regions differences, but then we face another challenge, which is combining these two classifications in a simple and a clear way. And that's it on my side. Thank you.
Very good. Big thanks to all the speakers already. We got a couple of questions that have lined up in the chat. There are some to Raphael, and I would suggest you take them virtually. Sorry, written. For the others, I think, Jérôme, you already answered the question of whether you consider the combination of different modes in the travel analysis you're doing. Maybe you want to also quickly say one or two words live. The other question I would pose to you is, we're talking a bit about transport performance. So it's not just about access, but also what kind of access could be provided. And Ugo gave this idea that we developed on taking what is available within a certain area, and then how much of those or how many of those opportunities can you actually reach, to also be a bit fair to the transport system, because in the end, if you build it a little bit to the left, a little bit to the right, no matter how good your transport system is, if you're living in the middle, it's really hard to get to the two ends. So is there this notion of performance of the transport system, how much you can do with transport alone, or do we need other kind of measures, land use, building regulations and so on, to complement what we're doing to help us out?
I was supposed to answer this, right?
Yes, please. Sorry.
Yeah. So, so the first question related to the incorporation of for instance, cycling and public transport. Yes, that's what we indeed do. Not just walking, using public transport and walking. However, in the report, we wanted to show how the different modes provide different levels of accessibility. But yes, you can just integrate cycling in to the station, for instance, or from your public transport node to your destination. And we ran a few simulations of that, how that compares, or how accessibility levels would improve if, for instance, I don't know, shared bicycles, for instance, are provided at stations. And we ran a few simulations and we included that in the report. The report is only in Dutch, but it's provided on our website, so you might be able to run it through Google Translate or so. have a look at it. The other bit, we're running some longitudinal analysis of how public transport accessibility levels changed over time to jobs and amenities, since we have GTFS data since 2012 at the national level. What you basically you can also disentangle how land use and transport components influence accessibility levels. And what you see there is that across the Netherlands, also in rural, suburban, but also in urban areas, accessibility levels have gone down due to a decrease in public transport levels. There have been heavy cuts basically everywhere in frequency levels. So that's going down, but we see an increase only for jobs of accessibility related to, well, the fact that there's a huge job growth in the Netherlands in the past decade. And also in areas that are well accessible, basically, but there's big differences between whether you can reach them as a low income or a low educated group or higher educated group. So by disentangling that, even looking over time, you'll see what's happening related to land use or transport changes. And in general, for amenities, for instance, accessibility levels are decreasing as a combination of decreasing public transport services, but also a decrease in the number of hospitals, GPs, schools in some areas. And as Rafael mentioned, it varies between areas. And typically disadvantaged areas will see heavier cuts both in service levels of public transport and public services.
Brilliant. Thank you very much. I think that this is one of the key benefits of working on infrastructure. What you provide today might even give you benefits in the future to come. So if you have positive spillovers from creating jobs, creating employment in connected areas, this can feed through to where you are. But something we don't discuss as much is that it might also have the negative repercussions. As areas are going down and you remain connected, it might actually drain resources. Hugo, Claire, we discussed a little bit the question of authoritative data, the point that Hugo raised. We had the question in the chat whether we can integrate public data sources in our analysis as well, and how we handle this. You mentioned that the population data was the one that was trusted the most, and therefore that was the main feature of the analysis. Could you kind of help us understand a bit better what might be necessary to make more use of publicly available information? What are the key criteria that we need to consider here? Because in the end, if I want to go and find a restaurant, I don't go to my mayor's website or the National Statistical Office, I ask Google. So what is the key threshold here?
Yeah, well, indeed, I don't expect any authoritative data on restaurants. But for public services, it becomes very common that there are good location data somewhere in the national and or regional administrations. And I think one of the major challenges at European level is to get hold to first of all about the existence of the information. And what we need is a kind of an extension of the European statistical system to a wider range of data providers, of official data providers, because this is not the kind of information that will channel through the statistical system. This is not the kind of information that will necessarily channel through the system of national mapping agencies. This is often very thematic information that is held by a Ministry of Health or Education or this kind of organizations, government agencies and so on, will all have their own agenda, their own way of working. And so in a first stage, what we have asked Eurostat to do is to harvest what is out there, to find out what is out there, and to make an inventory, to also to transform the data and to make the most of it, which is not ideal. There are a lot of attributes missing, but by simply starting this process, this can be the start of building a more sustainable, a more continuous effort of trying to enhance the data. It's only by collecting them in the first place that you're in a position to pinpoint what are the major flaws and to try to start improving the situation. Will this yield a result comprehensive result at short notice? Probably not. But I think it's still worth investing this. And I see gradually a certain improving awareness amongst the NSIs, amongst the national mapping agencies, that there should be a clear division of work, and that such thematic areas of geolocation should be dealt with by specialized data providers, and that they can play the role then of data integrators instead of trying to find the data from scratch.
Very good. We're kind of at time, so I'm going to briefly give the floor to Claire before we go to our conclusions. Claire, you looked at access to primary education. And of course, this is something that's very standardized in most of our OECD countries. People have to go there, and it's mostly in-person training. But when we think about public employment services, there's also a bit of a difference between the countries in how they're providing these services. Some of them might be more digitally enhanced, and a lot of services might be provided online, whereas others that are kind of still requiring in-person check-ins. Is this something you take into account in this notion of accessibility when it comes to specifically public services that we are also pushing in other kind of streams of work to become more digital, more easily accessible through the internet?
Yes, I think thanks for the question. So for accessibility to public employment service, this is also maybe why we used the 30 minutes time threshold, because people don't really need to access those services that often, especially since a lot of the resources can be provided online. But then public employment services can also be a place where people receive training, in-person trainings, which still have an added value compared to online trainings, and also to have face-to-face interaction. So yes, I mean, this is, I think, reflected in the fact that we are not using the same time threshold as for other services that people need to access more frequently. But still, our colleagues in ELS still believe that people should be able to access them physically.
Thank you very much. With this, big thanks to our panel, and back to Anna.
Yes, thank you, Alexander. Thank you very much to all of our panelists, our moderators, and of course the public for the question. This has been extremely rich and interesting. We just have a couple of closing remarks to finish. I start with Jorge Duran Laguna. He's the head of economic analysis and regional statistics at the European Commission, DG Regio. He will deliver remarks on behalf of the European Commission. Please, Jorge, the floor is yours.
Thank you very much, Anna. So indeed, I'm Jorge Duran. I'm the new leader of the economic analysis team. So I'm totally new to this world of spatial data and analysis. But in my learning curve, but I find it totally fascinating. I've learned a lot of things today. I've learned about that transport accessibility is a better way of saying something about the quality of a transport system than looking at speeds or infrastructure capacity, because this approach is really people-oriented, a people-oriented way of measuring how easy it is to reach a destination. I've seen that it relies on good and accessible data on various elements, on location, on transport networks, on rail and public transport timetables, etc. But I have seen, I mean, there are of course challenges, but there have been apparently important progress in these last years. I've learned also a lot about the importance of multiple approaches and flexibility to analyze, to set the framework to analyze all these issues. Different services, for example, differ in terms of frequency. I mean, we hopefully go to school more often than to hospital. This means that spatial provision and the catchment areas are different in size. This underlies then the importance of having adapted approaches, which we have seen today, and approaches that are flexible to accommodate different types of analysis and different geographical scales, like, for example, the urban analysis or the analysis of a catchment area, or even the wider regional analysis that have been presented today. So just yeah, basically this on a more personal note. As I said, I find these topics truly fascinating. I'm learning a lot of things, and I can only hope to be able to help from the Commission, or to help that the Commission contributes even more to more and better data and analysis, and to make it available to the community and to the public in general. Thank you very much.
Many thanks, Jorge, for those words. And now to close, I have Rudiger Arendt. He's the head of the Economics Data and Statistics Division at CFE. Rudiger.
Yeah, thanks a lot, Anna. I think that was an incredibly rich seminar with, I mean, really fantastic presentations. I personally must say, I mean, I haven't spent 2 hours, but I have learned so much. A lot this year. I mean, it's certainly one of the intellectual highlights. So, I mean, yeah, I've worked on transport, even though I've still learned a lot today. So it was really very interesting. So thanks everybody who's been involved. I mean, thank you to all the keynote speakers, to all the presenters, to the moderators, to Nadim, and last but not least, also to the team who has been organizing, I mean, this in a very effective and flawless and fantastic way. And also last but not least, to the European Commission and DG Regio, because without their support, I mean, most of what we talked about and also the seminar here wouldn't have happened, basically. I'll try to be quick, given that we're already over time. I think there was 3 main issues that emerged from the debate. I mean, obviously we touched a lot of different subjects, but basically kind of like also a bit looking forward. The first one is obviously the issue of data availability, and there work needs to be done, but that's also known, and at least among all the people who are working in the community, maybe less on the political side, but there is more progress to be made. But that seems to be relatively clear what needs to be done. Let's go this way. Then the second point is what I may call harmonization of standards, or basically what to calculate and how to calculate it, and what data to collect and which way to collect the data. And the meeting today showed a bit that and it was also mentioned by Raphael, for example, that seems to be still a problem, because I mean, to a certain degree, the international comparability of all these statistics is a bit hampered by the fact that the way data is calculated, the way data is collected, and also the way indicators are calculated is sometimes done a bit in a different way, and that also seems to be in part maybe even within organizations as the OECD. So I mean, there's a certain need of harmonization, and maybe also I hope Alessandro, maybe in the WTPI, maybe we can also be playing some role on that. And the last point was basically that, and that's also a point Rafa mentioned, the need to basically, when we're thinking about kind of like which indicators we should be using, I mean, we need to be thinking also a bit more what kind of like what are the aims, what do we want to achieve? For example, everybody's talking about the 15-minute city. So do we really want to be measuring, cities and areas against the 15-minute criterion? I mean, maybe that's something which is more like something that's maybe just adapted for the center of Paris and maybe the inner city areas of some large metropolitan areas, but maybe not for everybody else, or kind of like talking about the poverty line. So I think there's also the need to be being a bit more in a conceptual mode, and also touching with the policy making community and understanding what are the aims we are trying to achieve, because that in a way will also kind of like guide us in choosing which are the indicators which are most important to calculate and to harmonize and to basically present. With that, I just wanted to say that we are currently working on an update of the accessibility indicators that were earlier mentioned, that were calculated in the project that was done with the ITF and the European Commission, and where for example, Alexander from our side was also involved at the time. And we are currently in the process of updating them, and we're going to put them in our city database in a not too distant future. So, I mean, those of you who have been waiting since 2021 for an update, it is happening, it's coming soon. So on this positive note, I wanted to end again my thanks to everybody, and back to Anna.
Yes, thank you very much. Just to say thank you, Alison, Karsten, for fantastic organization, and Carlos and Marcena for behind the scenes support. Thank you very much to all our speakers. I'm sure this is not the last time we'll meet. Transport community is a very tight community. You know each other very well. So I'm sure we'll be in contact in some very near future opportunity. So thank you very much, and good afternoon to everyone.
Thank you.
Bye-bye.
Bye-bye.
Bye, everyone.